Hello there. My name is Dr. Yeleti. I'm the Chief Physician Executive at Community Health Network. I want to give a brief update today about all the activity that's going on with COVID-19. I know there's a lot of anxiety, a lot of questions, a lot of concerns, and so I want to kind of lay out what's going on and what we think we should be doing at this time. First and foremost, as many of you maybe understand, the WHO recently said it's now a pandemic. What a pandemic means is that there is a new disease in the world that's affecting the majority of countries and is continuing to be transmitted from person to person. One of the main reasons that the WHO has declared a pandemic, they stated, is that they are very concerned that there's a significant amount of inaction in terms of what we're doing to deal with it. So let me explain that, because I know some of you are thinking, well, what do you mean inaction? It sounds like we're going overboard the other extreme. So the biggest issue about COVID-19 is that there's a new infection for which we have no treatment. And so for those people that are most vulnerable, and I mean people that are older than 60, if you get COVID-19 infection, if you end up getting a pneumonia, we don't have any treatments for it. We don't have any antibiotics, antiviral medications. All we could do is what's called supportive care and hope your body can fight the disease and recover from it. So that's the reason why it's so critical. We already know studies from China and Japan, if you're really below age 30 or below age 50, you're not going to get sick. You're not going to die from it. We already know that. So it's not about how's it going to affect me, but it's about me and everybody else you're going to be affecting. So the reason we're trying to be so aggressive with this is to try to minimize the number of people that are the elderly that are going to get sick from it. And so the more aggressive we could be early on, hopefully there'll be less patients that actually end up having problems with it at the end. So it's the transmission of the disease that we really want to minimize. So people that have children or feeling otherwise healthy are thinking, well, what do I need to do? The most important thing to do if you're having symptoms of flu-like illness, a cough, or cold, or temperature, is restrain yourself, seclude yourself, whether you're a child, middle age, any age, so you don't spread the disease. Again, all children and most adults will get through it just fine, but the most important thing you can do for society is to make sure the elderly don't get this infection, or people who have other significant health problems. That's the reason we're trying to do this, is that if we don't do this, this will rapidly spread, and we're going to have significant issues trying to take care of these people. As a point of fact, in Italy right now, there's so many elderly that have been infected, they're running out of ventilators to help with those people. Just in the city of Indianapolis yesterday, there was a several-hour meeting where all the Indianapolis clinicians came together and deciding if we can run the same situation when we're running out of ventilators, how do we ration the ventilators? What I'm hoping, if we could at all possible, is prevent the spread of disease so we don't reach that point. So what we're urging people is to use common sense. If you have symptoms, stay inside, keep yourself secluded until the symptoms go away. And if we could do that early on and be very broad about it, that hopefully will limit the spread of the disease and the potential mortality from the disease.